Let's be real. Our current healthcare and support systems were not built with chronic illness in mind. They were built for emergencies, temporary sickness, and profit. If you've ever felt dismissed, denied, or completely invisible in a system meant to help, then you already know the problem. But it's not just healthcare. It's the workplace, where people expect perfection. You've lived it. Denied accommodations, rushed appointments, side-eyed at the parking place card, medical trauma disguised as standard procedures, no sick days, no understanding, no space to just be. This isn't just poor design, it's systemic neglect. I'm Gwen, and I've been there too. Misdiagnosed, unheard, and nearly lost in a system that almost cost me my life. But out of that pain came purpose. Empowerment in illness exists because we deserve more, and I believe we can build something better. In this episode, we're going to map out a vision, a real one. Together, we'll walk through what a chronic illness-friendly system could look like in healthcare, in the workplace, in schools, and in everyday communities. By the time you finish listening, you'll know the flaws in today's system, what a patient-first model actually looks like, and how we, as a community, can begin building it step by step, brick by brick, with justice, accountability, and humanity at the center. By the end of this episode, you'll be equipped with tangible, radical ideas to advocate for change, whether it starts with your doctor, your employer, or your own front door. Get comfortable. Grab a notebook and let's talk, warrior to warrior, about how we create the system we deserve. Let's start with healthcare and work our way around the world. Let's begin where most of our chronic illness journeys start, the doctor's office. For too many of us, that's also where the trauma begins. Chronic illness isn't rare, it's common, yet somehow we're still treated like anomalies. Medical education devotes shockingly little time to autoimmune diseases and invisible conditions, and providers are rarely trained in how to deliver long-term integrated care. We've inherited a blueprint that prioritizes acute, episodic treatment, leaving the chronically ill to fend for ourselves in the margins. The red tape is endless. Insurance dictates care, and if your labs are normal, you're often gaslit into silence. For many of us, the diagnosis was just the beginning of a lifelong battle, not with the disease, but with the system itself. This isn't just inefficient, it's harmful, and it's time we stop accepting it as normal. Imagine a healthcare system where validation is the default, not something you have to earn, a place where your symptoms are not doubted or dismissed. This is the foundation of a trauma-informed care model. Instead of rushing to judgment, doctors listen, they pause, they ask questions that matters. They understand that chronic illness isn't just about lab results. It's about your life. Now think about the time you spend in an exam room. 10, maybe 15 minutes? That's not enough when you're juggling a rare disease, medication interactions, mental health fallout, and a complex body. Appointment lengths must reflect our complexity. Chronic illness is layered, it's messy, and we deserve the time to unpack it without feeling rushed or brushed off. And what if your primary doctor, rheumatologist, neurologist, and therapist actually worked as a team? That's what continuity of care really means. Right now, we're stuck being the messenger between specialists. But in the system we deserve, care is connected, coordinated, collaborative. Every treatment plan, every possible side effects, every alternative, you know it all. You are not left guessing. Full transparency is the standard, not the exception. Your body, your choices, your rights. And finally, telehealth isn't a backup plan. It's the go-to, especially on flare days. If I could barely walk to the kitchen, how am I expected to sit in a waiting room? Telehealth allows us to receive care with dignity, where we are, as we are. This is what redesigned healthcare looks like. It sees you, it believes you, and it's built around you, not despite you. Next, we need to talk about where most of us spend our energy when we're not managing our health, the workplace. In the system we deserve, remote work is not a luxury. It's a baseline option for anyone who can do their job from home. Chronic illness is unpredictable. Flexibility should not be earned through burnout. It should be built into the structure. And when flare days hit, because they do, you shouldn't have to justify them. Flare day flexibility means you can step back, rest, recover, and return when you're able. No guilt, no suspicion, no loss of wage or respect. Let's also redefine what it means to be productive. Productivity isn't about how many hours you sit in a chair. It's about the outcome, the impact, the contribution. If you can complete your work in fewer hours with more focus and intention, why should that be penalized? We also have to educate leadership teams on chronic illness culture. That means understanding invisible symptoms. It means dismantling ableist assumptions. And it means taking a hard stance. Zero tolerance for stigma. None. Not from coworkers, not from supervisors, not in policy, not in culture. You don't stop being valuable because you're chronically ill, but the system has made too many of us feel replaceable. It's time we flip the script. Now let's talk about school. For many, chronic illness started in childhood, and for young warriors, the system failed them early and often. Individualized education plans, IEP, and 504 plans must reflect chronic illness realities. That includes fatigue, cognitive fog, missed days, and the emotional toll of being different. Schools must be equipped to support, not punish, students managing illness. Teachers should be trained in more than just academics. They need to understand chronic conditions and how to respond with empathy, not frustration. That one teacher who gets it can change everything, but one teacher is not enough. Young people deserve to see themselves in the curriculum too. Health education must include representation of chronic illness, autoimmune conditions, and disabilities. This is how we normalize, educate, and empower not just patients, but their peers. Mental health support must be automatic for children navigating medical trauma. Counseling shouldn't be a referral. It should be a resource woven into the school days like math or lunch. When we get education right, we raise a generation that doesn't have to unlearn ableism. We raise advocates. We raise students who feel safe enough to dream big, even with the diagnosis. To build this new system, we need to get serious about 3 core pillars: equity, representation, and accountability. Equity means acknowledging that not everyone starts from the same place. BIPOC patients, LGBTQIA+ folks, women, low-income communities all face systemic barriers that worsen outcomes. A just system doesn't treat everyone the same. It meets people where they are, with tailored solutions, interpreter access, transportation support, and cultural competency at every level. Representation matters. Chronic illness research must include all of us, every race, gender, body type, and age. We need more disabled providers, patient leaders, and decision makers shaping the landscape of care. No more clinical trials that exclude the people most affected. No more one-size-fits-all treatment plans. Accountability means we don't just dream, we measure. Are providers being evaluated by patients with chronic conditions? Are systems penalized for harm? Are policies actually being implemented in ways that help the most vulnerable? Without teeth, our vision is just a wish. What area of the system do you feel most called to change? Research, policy, workplace rights, education, or community care? Lastly, Let's step outside into the world that was not built with us in mind. Accessibility isn't just ramps and elevators. It's benches for fatigue, restrooms without shame, air filtration for immunocompromised visitors, quiet hours in public spaces, sensory-friendly zones. Accessibility must be redefined through the lens of lived experience. We need to reclaim travel too. That means priority seating, early boarding, and hotel accommodation that goes beyond wheelchair access. Traveling with chronic illness is exhausting enough. The world shouldn't make it harder. Grocery stores, salons, churches, and gyms, everyday places should be designed with us in mind. We are not asking for favors. We're asking for inclusion. And let's not forget about public policy. Chronic illness must be recognized in local planning. That includes emergency response systems, voting accessibility, and community design. When you build a world with chronic illness in mind, you build a world that works for everyone. You build safety, comfort, respect. We're not waiting for a savior. The truth is, we are already building this future. Every time you advocate for yourself at the doctor's office, educate your employer, or speak your truth online, you're laying bricks. Every person who joins Empowerment in Illness, who shares their story, who support our podcast, who wears the message on their chest, you are part of the movement. We build through community-led research, patient-led startup, mutual aids, scholarships, symptom tracking tools, and platforms like this one. This is grassroots revolution, one connection at a time, one voice at a time. It's not about perfection, it's about persistence. This is your moment, warriors. Think of one thing you want to see changed in healthcare, the workplace, school, or your city. Now speak it, write it, share it, advocate for it. Tag Empowerment in Illness. Start a conversation. Use your voice to build the system we deserve, brick by brick, story by story, law by law. We are not powerless. We are the blueprint. Before we leave, I would like to close with a special portion of the show I call Healing Heartbeats. This is where we allow ourselves to wallow in sorrow. Give yourself 3 minutes to laugh, cry, scream, cuss, or just sit in silence. Whatever you need to do to feel it, do it. Let the depression in for only 3 minutes. Once you've reached 3 minutes, compartmentalize it and get back to living. This is a rinse and repeat behavior. You cannot let depression take over, because when it does, it will not let go. When we hear about the passing of someone, they have the day they were born and the day they pass away. There's a dash in the middle. It's not a long line, but a short dash. That dash represents your life. Go live in spite of having a chronic illness. Don't let your condition stop you. Today's episode asks you to imagine more and demand better. We walk through a world that could exist if chronic illness wasn't an afterthought, if equity wasn't optional, if dignity was a right. You felt it. You visualized it. Now we carry it forward. You are not just a patient. You are an architect of change. The world needs what you know, and the world will shift when you speak with one voice. Thank you for joining me on another episode of Empowerment in Illness. Remember, you have the strength, the heart, and the support to continue your journey. Be safe.